There was recently a press release about an app that I developed for prostate cancer decision making, and I was quite flattered that what I think is a very good prostate cancer blog associated with a very respectable prostate cancer foundation commented on it. And what was neat about it is they did it from the standpoint from Penelope. Now Penelope right here has got a problem with sticks, and as you'll notice, she's not digging, okay? She's scooting the stick. I had a neighbor up the river said, "John, please don't let your dog dig." And I said, "Well, she doesn't dig, she scoots." But what was interesting about the little note that was on the blog is it was from the perspective of Penelope responding to my app, but it mentioned, "I know that your daddy is a urologist and that he's been biased," or paraphrased, so to speak, that he's a urologist and you have to take for a grain of salt that he'll recommend surgery. Well, I'll take issue with that. I mean, is the used car salesman biased? Is the new car salesman biased? Is the guy on Twitter that sells nutritional products for the treatment and prevention of prostate cancer biased? Is the guy who writes a book on holistic medicine biased, knowing full well that a Gleason 8 adenocarcinoma of the prostate is not going to listen to a thing that vitamin E or saw palmetto, as zinc's going to say? What about the people out in California that have the multi-million-dollar proton machine recommending proton therapy for prostate cancer? Are they biased? Or the guy at the hospital who does seeds? Or the fellow that takes somebody down to the Bahamas to have the nano knife? Or the experimental program at Emory using the nano knife? Are they biased? Well, sure they are. But that's okay. Here's what you do. This is the whole point of this video, and it's to show you how do you make a decision about prostate cancer. First of all, do your homework. Find out about who you are, what's your health, what's your longevity, what's your physiologic age, what are the specifics of your prostate biopsy, what's your Gleason score, what's the volume of the cores, and then what are the risks that are most important to you. Incontinence, risk of surgery or treatment, risk of doing nothing. Look, there's a risk in doing nothing or surveillance therapy, but there's a risk in doing something, i.e. whether it's surgery, radiation therapy, etc. So here's what you do. Talk to everybody. Read about everybody. And in the end, make a decision based on the assimilation of all those bad, biased people out there, to include your urologist. I think you'll find probably that your urologist isn't as biased as you think. Maybe yours is. So you're a big boy. Know about yourself. Know what you want. Talk to the people. Talk to all the biased people. And then make a decision that you feel is best for you. And this is John McHugh, author of The Decision on Amazon. And this has been another Prostate Diaries Minute, but it's not really a minute. Peppy, you want a stick, baby? Go get your stick.